The NanoKnife IRE surgical ablation system is the first to use irreversible electroporation, also known as IRE, to ablate soft tissue. 2 or more NanoKnife IRE disposable electrodes are positioned in or around the area to be ablated, and an electrical field is created between them in a series of microsecond pulses, which induces cell death in the encompassed soft tissue. Unlike cryoablation or microwave ablation, which use thermal treatment to destroy tissue, the NanoKnife IRE system treats without exposing tissue to extreme cold or heat, eliminating a major cause of treatment failure and possible damage to tissue adjacent to the treatment area. Treatment duration for a NanoKnife IRE system procedure, ablating a 2-centimeter diameter lesion, is typically less than 5 minutes. Unlike microwave ablation, which uses heat to destroy tissue, the NanoKnife IRE system treats without causing thermal defect. The IRE treatment is minimally invasive and is performed under general anesthesia with ultrasound or CT guidance. Preoperative imaging allows precise calculation of the tissue volume and shape to be ablated and aids the planning of appropriate positioning for the NanoKnife IRE electrodes. An IRE treatment using the NanoKnife IRE system consists of a series of at least 90 extremely short electrical pulses, each less than a microsecond. Cell death is induced within minutes, and the patient can often be released from the hospital the same day. The NanoKnife IRE system induces cell death in soft tissue. NanoKnife electrodes are placed in proximity to the targeted lesion, but unlike thermal ablation technologies, surrounding critical structures, including ducts and blood vessels, remain functional. During treatment, the NanoKnife IRE system's unique action opens permanent nano-sized pores in the cell membrane, causing irreversible damage, which induces a cell death, which mimics natural cell death. After treatment, the ducts, blood vessels, and other collagenous tissues in the treated area remain viable. Microscopic imaging after treatment reveals a sharply delineated separation between affected and unaffected cells. Unlike other ablation technology, the NanoKnife IRE system acts directly on the cell membrane, which causes the cell to die. Microscopic holes or pores form in the outer membranes of the cells in the treated area, and the cells begin to break apart. The cells are no longer viable, and the body's healing response begins to absorb the cell fragments and remove them from the body. The treated area heals naturally, much like a bruise. After the procedure, the treated area begins to resolve within hours. Doppler ultrasound imaging during NanoKnife ablation demonstrates the patency of blood vessels as small as 1 millimeter in diameter in the treated area. 30 to 90 days after a NanoKnife IRE system procedure, CT and ultrasound imaging reveal a mostly normal appearance, with little remaining evidence of the IRE treatment. As seen on imaging, critical blood vessels and ducts continue to function normally after treatment, maintaining blood flow in the treated area, which aids healing.